I'm going to share with you a stroke recovery guideline, and this is going to be a complete picture and be beneficial if you're a stroke survivor or a caregiver to a stroke survivor. So I'm going to go through the stroke medical management, and I'm going to go through the rehab progression for stroke survivors. Next, I'm going to look into the stroke recovery and what it looks like for you and some of the myths that surrounds this. And I'm also going to tell you what are the rehab services that are available for you and the pros and cons for each of these. And lastly, I am going to talk about some equipment that might benefit you. So for each of these category, there are timestamps in the video here and also in the description. So skip ahead if you do not want to watch the entire video. Additionally, I'm also giving you a free PDF copy of this summarized version of this video, so you can look at that if you ever want to refer back to this video. So let's start off with the stroke management. In the medical setting, when you have a stroke, it is good that you get early medical attention as soon as possible. And some of the things that will happen is that immediately in the emergency department, you'll be assessed, and if needed, you'll do further brain imaging scans. And you can actually look into some clot busting medications, blood pressure control, thrombectomy, and also some surgery if required to actually relieve the pressure in your head. All of this actually depends on what type of stroke you have, whether it's an ischemic stroke or a hemorrhagic stroke. So ischemic stroke is basically something like a clot that is blocking the blood supply to some part of your brain and which causes it to be damaged. And for hemorrhagic stroke, it's just a blood vessel is bleeding into the area because of a rupture, and this will actually damage the area that the blood actually is supplying to. So there you have it. This is the medical management for stroke, and I'm not going to go into much detail because there's a lot of other videos that actually explain this in a lot more clarity. And for me, I'm going to focus more on the rehab aspect. So let's get into the rehab progression. So immediately after you have been deemed clear by the medical team to start your rehabilitation journey, you have to start your rehab ASAP, because this has actually shown to have a lot of positive outcomes for you, especially in terms of functions and also in the length of stay that you stay inside the hospital. So early access to rehab is very important, and you have to get it for yourself. And if required, you actually can speak to your team to actually find out why this early rehab is not happening and suggest it to them if they are not aware of this. So next, what happens is when the therapist comes to assess you, they do a comprehensive assessment and they will check about what are the strengths that you have and what are the deficits that you have in terms of your cognition, your physical, and also your functions, what you are not able to do. So based on this, you will fall into a few categories. The first category is that you might not have enough strength to even get up off the bed, and you might be in a situation where you are largely bedbound. And for this, then the therapist will actually move into getting you into sitting more upright and eventually being able to balance yourself in sitting independently. If you're starting off from a position where you can sit relatively well, then the next position that the therapist will try to train you is to actually get you into standing and getting into standing independently. If you're starting off by able to stand independently, then the next thing will be to get you into walking. And if you're already able to walk, then the next thing will actually to be get you into walking with a little bit more better balance and preventing falls and also increasing the distance that you're walking. So these are the general rehab progressions that you can expect for yourself depending on where you start and also depending on what the therapist has in mind for yourself. But if you are lost and you do not know where to start, then this is a good guide for you as to what to expect in your rehab progression. So there is one crucial thing to take note in all of these categories that you are working towards to is this thing called verticalization. Verticalization basically means getting you into a more upright position so that your muscles get to be stimulated and start to be recruited because gravity is pulling you down and your muscles are activated to keep you more upright. So this concept of verticalization is very important, especially for a stroke recovery journey, because you actually start to recover much better if you're in a more vertical position. So this is the main concept of rehab progression. We want to get you into a more vertical position. So now we are going to look into the stroke recovery and some of the myths that surround it. So a lot of you might have heard the golden period in stroke recovery is the first year. Within this first year, stroke can actually be divided into different categories. First, the hyperacute, followed by the acute, then comes the early subacute to late subacute, and lastly the chronic stages. And for each of this stage, your improvement in impairments and functions will follow a non-linear recovery trajectory. What this means is that it is not always going to be a straight and clear line. There will be periods where your recovery of your functions and impairment will start to slow down over the course of your stroke recovery journey. So why recovery is fast in the early stages is because your brain will be in an increased state of moldability, or what we call plasticity. And this will actually get your brain to rewire more efficiently and also take on some of these affected regions. The unaffected areas will be able to compensate and form neural connections to take on some of these affected regions. And on top of that, you are also undergoing a lot of rehabilitation and training, and this just means that you are having more opportunity to use your affected limbs and recruit some of these muscles to get yourself into a more efficient pattern of doing your daily functions. And also, these early gains will be noticed and will be more prominent for you. So you will also start to feel that you're actually improving at a faster state in the early stages. And also, on top of that, inside your brain, there will be a lot of reabsorption of this dead tissue that's happening, and the swelling will start to slow down and will actually reduce in size. And this may eventually start to wake up some of these affected areas around the outer regions of the stroke area, which is called the penumbra. So, with all of these factors looking at it, this is the reason why a stroke recovery will be fast in the early stages, and eventually all of these factors will start to slow down, and this is why you may start to see a slowing recovery towards the later stages of your stroke recovery. On top of that, your motivation and fatigue will also matter quite a bit. In the early stages, your motivation is usually high and you will be very keen to do a lot of activities. But over time, you may start to see that by doing more and more, you are actually not recovering as fast as you used to. And this is where fatigue and frustration may set in. And this will also indirectly affect why you're not recovering much more faster, because you're just a little bit more annoyed and frustrated by the pace of recovery. So that is something that you should be aware of also. So with all of that said, will your recovery ever stop in a stroke journey? My resounding answer to that is a no. Your pace of recovery will slow down, but recovery does not stop, because this plasticity is actually ongoing throughout the rest of your life. And there are very important things that you must be aware of. When a stroke survivor starts to plateau, meaning their functions start to remain the same for a long period of time, my most importantly, I want to look at is whether their training has plateaued rather than whether their functions has plateaued. Because if your training has plateaued, it means that you're not challenging yourself, you're not looking into further goals to do, and you're not actually following a training regime that keeps you on your toes and actually gets you to be more stronger over time. So instead of looking whether you are plateauing as a stroke survivor, look at whether your training is the one that is causing you to plateau. Because most of the time, inadequate and inefficient training regime is what will cause you to be plateauing towards the later stages of your stroke recovery. So, to look into this aspect, there is three key elements that you must be aware of to allow yourself to have a continuous recovery. The first is your mindset. Your mindset matters a lot, because if you're going to think that recovery stops now, then you will forever just remain in this state. The next is your challenging yourself via rehabilitation. You have to seek out new challenges and new goals to aim towards, and you must also talk to your therapist on what you want to achieve eventually. Whether it's reducing the falls that you're having, walking for longer distances, or getting out by the bed by yourself, and also moving from chair to chair and on your wheelchair. So these are some of the goals that you can explore, and you should always be aiming to go towards the next level and not stop. You can take breaks, but do not stop achieving the next level because you think that you're not able to recover because your stroke is in the later stages. And lastly, you have to review yourself in every single year. You have to see how far you have come, or whether you're not progressing at all. Because by reviewing, you are able to see that you are actually stopping yourself, and maybe some other factors such as medical conditions may be limiting you, which you may need to seek medical attention for. So if you do not do this review, then you're going to be stuck in this year, and over the years, you're just going to remain the same functions. So these three key elements are very important for you, and you must be aware of this to prevent yourself from not recovering over the long run. So the next thing we're going to talk about is your rehab services that is available for you. So after you have been medically stabilized and done some rehab in the hospital, there will be a conversation for you that is coming up. Where do you continue your next phase of your rehab? So there are a few options. First is the home therapy, meaning the therapist comes to your house and does therapy for you. Next is an inpatient rehabilitation center, whereby you are staying in like a hospital setting and you're getting fairly daily rehabilitation by your physiotherapist, occupational therapist, or even your speech therapist. And lastly, it is the outpatient rehabilitation services, whereby you are staying at home, but you are making daily or every few days you are going to a therapy center for your therapy needs. So starting out with home therapy, the pros is that the home therapy team will actually be able to cater to your needs and to your convenience and to your timing. And also, they can provide you a more personalized service by using whatever you have at home to get you better. And this is important because sometimes in a rehab center, you may be using different equipment and it may not be the same as when you get back home, which means that you have to learn all over again. But having done this at home, you're actually able to practice almost instantly because you're staying at home. However, with that said, the cons is that when the home therapy team comes, it is usually one therapist and at most a therapy assistant may be following along. And this will also be very limited because they may not have extra manpower, especially if you're a little bit more bulkier and require a lot more assistance. So, for example, they may also not have rehab equipment with them because some of this rehab equipment is very bulky and it's not feasible for them to bring from home to home. So, if you are a person who is requiring a lot of assistance and needs specialized equipment, then this is where home therapy may not be as suitable for you. Next is the outpatient rehabilitation center. What this means is that you are staying at home and you are taking a transportation to go to this outpatient rehab center. The pros is that you actually stay at home, so you can actually have social connections with your family members and your loved ones. And also, you can have a best of both worlds in the sense that you can go to a therapy center and have access to specialized equipment and also the manpower. The cons, however, is that it does require transportation and you may not be able to do it daily, especially if it is difficult for you to get out of the house. Lastly, for the inpatient rehabilitation setting, this is very good if you are actually transitioning from a hospital to an inpatient rehab center, whereby you get access to specialized service and intensive rehab for up to 5 times a week. And this is very beneficial in the early stages where you get the intensive practice and repetition, and this will lead to a better improvement for a lot of people. The cons is that this is likely going to be a hospital stay and it might be costly for you, and also you may not be able to go home faster to spend time with your loved ones. So for each of these service, there is pros and cons, and depending on what are your needs, then you have to choose the one that is most relevant for you. With that said, all of it has its merits and you will see improvements in either one of these services with the right therapist. So for all of these services, there are some tips that I want you to incorporate. Firstly, whoever is your therapist, you have to discuss with them what are the goals that matter to you. This is very important because when you are engaged in setting the goal and actually seeing how the treatment will lead to the goal, only then will you be even more motivated in your therapy session. This will help both you and the therapist because they can plan for you better by knowing what you truly want to achieve. Next is that you want to ask them for homework. And by homework, I mean that exercises. So most of the time, you are only going to get up to 1 or 2 hours of therapy in a day. And that means that you have a lot of hours that you do not have therapy during. And this is the period where you really need to exercise because whatever you learn in therapy is not enough. You have to practice it throughout the rest of the day. So ask them for simple things, for simple exercise that you can do at home or in your bed or in a sitting position. Next is you really want to limit the time that you spend in the bed. Where possible, get out of the bed in a sitting position or get yourself into a walking routine if wherever possible and wherever is safe enough. Because the longer you spend time in the bed, the more faster you're going to decline and your muscles are going to get weaker over time. Now, the most important tip is that a lot of stroke survivors, after going through such a difficult phase, will fall into depression or have low mood. And this is very common, and a lot of times it may go undetected because people may not be willing to share it. If you start to feel low and start to feel negative emotions, there is help out there. You want to speak to your doctors or even a psychologist for your team, and you want to talk to them and see how you can reframe some of these negative thoughts that you're having to lead to a better recovery journey. A lot of my clients that I've seen who have this low mood, when they start to see a psychologist and start to reframe some of these negative thought patterns, I can really see the improvements that they make in the next few sessions for my therapy because they are a lot more engaged and they are willing to do the hard things and not be too frustrated and disappointed by their current functions. So this is very important, and there is help out there in terms of therapy and also in terms of medication. So please have that conversation if you feel that you're having low mood or suspect that you might be in depression or your loved one is in depression. So coming to the end, I'm going to recommend 3 equipment, and the first is a TheraBand. TheraBand comes in different colors, resistance and lengths, and they can be tied to the end of your hand and your leg, and in a lying down position or a seated position or a standing position, you can actually do exercises safely and strengthen up your limbs even in the comfort of your own home. Next is the ankle weights. Similar to the TheraBand, the ankle weights can be actually attached to your ankle or even to your wrist, and some of these exercises that you do in your TheraBand can also be done with an ankle weight. Lastly, it is this bed rail. Bed rails are very important because when you come home after a hospital stay, the bed that you may have at home may not be the same one that you're using in the hospital, and this means that getting out of the bed will be a little bit more difficult for you because you have not practiced it at home. So by attaching this bed rail that it goes under your mattress, you can actually hold on to it and get up and even stand up in a much more safer manner without falling over or hitting your head anywhere. So to end off this guide for stroke recovery, I just want to say 2 things. First is that the only person that is limiting your recovery is more likely to be you and also your training that you are undergoing. So if you want to recover better, then look into your mindset and the training regime that you're undergoing. If you need help, these are some videos that you can take a look to strengthen your leg and your trunk in the comfort of your own home. And also, this is another video here to actually look into the mindset for yourself for your stroke recovery journey. So do share with me your stories if you're keen, and I'll see you in the next video.